Good afternoon, everyone. Welcome first of all to this session on applying to graduate school. This is a part of National Public Health Week, and we know that there are a number of students who are undergrad and are considering joining graduate programs. And so we wanted to get together kind of more of in a casual way to talk about how to apply and to get some really best practices from those who have been in the program and some who are actually still in the program. So we have a panel of both students who have graduated from our program, as well as one panelist who is actually still in our program. And I will be your moderator. My name is Denise Gouveia. I am the Director of Academic Assistance here in the School of Public Health, and graduate admissions is done through our school, our unit. So we thought it would be appropriate for me to moderate. I think what I'll start off by doing is having panelists introduce themselves and tell us a little bit about who you are and your experience here at Georgia State, and also who you are, what you're doing now. And I figured we could start with you, Gabe, and then we could go with Brittany Carter, and then Brittany Jerry.
Hey everybody, can you hear me?
Yes.
Awesome. Yeah, so my name is Gabriel Argueta, or I also go by as Gabe. I graduated in December of 2022, and actually when I first enrolled into the master's program, I started with the graduate certification, and then I continued on to the full master's program. And I currently work at Georgia Department of Public Health as the vaccine preventable disease surveillance epidemiologist, where I investigate different infectious diseases, specifically pertussis and mumps. And that's just a little bit of my background. I'm happy to go a little bit further into it later. Thanks.
Good afternoon, everyone. My name is Brittany Carter. I like to consider myself a double panther because I got my undergraduate degree at Georgia State in psychology with a minor in sociology. And then I came back in 2015 to get my master's in public health with a concentration in health promotion and behavior. Currently, I serve as a health scientist at the Centers for Disease Control and Prevention. And in this capacity, I evaluate our injury prevention programs among tribal populations. So really exciting work. I have a lot of experience in HIV prevention. I like to consider myself an evaluator, a mentor, kind of like not necessarily fit myself in one box, but really just being able to apply my skill set to various project areas. And I'm excited to be here.
My name is Brittany Jerry. I am currently in the MPH program. I am graduating in May. So I started the program in 2022. And I also, at the beginning of 2022, and it took me a semester longer because I decided to get a graduate certificate in nonprofit management as well through the School of Public Policy. And that's been like really helpful and really cool because I've been able to take some classes that are kind of like related to like health policy. I currently work in a research lab with Dr. Rochelle Leone and doing research on sexual assault and bystander intervention. So I'm really passionate about violence prevention and specifically intimate partner violence. I'm doing my thesis right now on intimate partner violence within lesbian and bisexual relationships of women of color. So that's kind of like my focus area. I'm really like passionate about that kind of stuff. I feel like the program has been really good. When I came in, I was really like interested in substance use. And so I kind of like found the intersection of that with IPV and like alcohol involved IPV. I'm doing more research on that. And yeah, I'm really excited to be here.
Well, thank you all over our panelists. You know, we really appreciate you taking the time to come out and talk to students who would be interested in applying for graduate school. We feel like you are the experts because you've been through the program or you're actually in the program. And so what I will start off by doing is we have some questions that we received, and we want to ask those questions, and not in any particular order, but wanting to just get some insight from each of you. If you want to chime in, do so, please do so. And we'll go through the questions. We'll try to get to as many of them as we can. So I'm going to start with this question. What influenced your decision to pursue a graduate degree in public health? And you can go in any order that you would like.
I don't mind starting, Denise. Thank you for that question. I think for me, my trajectory or like my path was a little different because there wasn't a public health program when I was in undergrad. So I honestly wasn't too sure what public health was. It wasn't until, I started working at Emory University and kind of connected with a student there. And at the time, I was very interested in doing sociology because my mind was sociology. So I was like, oh, I want to be a sociologist or like ethnographer. Like I was going down different paths. And when I was speaking to my then supervisor about like what my interests were, they were like, it sounds like you're interested in public health. And I was like, public health, what's that? Like I had no idea what public health was. And then of course, it wasn't until meeting other people who were in the public health program, getting that mentorship and networking with other people who were either currently in their master's program or are looking to, go into their master's program. That also helped me learn more about what public health was. And it kind of just really set the stage once I actually started working in the community, actively doing public health work. I was like, okay, this is where I need to be. This is where I want to be. So I think it's really on touching on that piece of the people like helping to mold you and pour into you to help guide you towards your throughout your process. So that's really kind of how I got interested in public health, was really someone let me know that my goals that I was speaking about were public health related. And here I am.
Thank you. Anyone else?
So, ironically, Brittany, that's very similar to my background as well. So initially, in my undergraduate studies, there really wasn't a public health specific degree. And I actually was more interested within the business field. And at the time, I had enrolled in some kinesiology courses and some general health electives. So I started learning more and more through that, and I actually found my passion just taking a bunch of different courses that the school offered regarding public health or just general epidemiology. And I was actually just speaking about public health to one of my friends, and ironically, that's how I met my mentor, who worked at CDC within their school-associated violence surveillance program. So really, it was just that coincidental conversation that led me to kind of start learning more about public health and different aspects. And I was able to intern with them and then continue on. And from there, it was just trying to pinpoint what I actually wanted to specifically study. But they also had ironically graduated from Georgia State as well. So they kind of held me, like pushed me into the right direction for going back in here to get my graduate degree as well. So that's a little bit of my background.
So my background, I did my undergrad at Georgia State, and I did it in journalism with a concentration in public relations, actually. And I had worked in the communications field for a while. I worked for the Georgia Department of Transportation. I worked at a radio station for a while, and kind of really just in the communication sphere. And I kind of was really passionate about like there's a bunch of like LGBT organizations that I would volunteer with and work with, and kind of was really passionate about like social justice and things like that, and really just wanting to do something that I felt very like passionate about. I was kind of like very like COVID happened. I was like not very like engaged in what I was doing. I was like, I want to do something that has more meaning. And kind of just realizing the lack of like communication that there was for certain populations, and like specifically the LGBT population, and like how they need there's different messaging that works effectively for different communities. So I kind of was like, oh, like how can I kind of get like my background in communication and what I kind of love doing like outside of work, and how can I marry those two together? And I found public health, and I have really enjoyed it ever since then. And I applied for the program, and yeah, it's been great.
Thank you all very much. Those are some really great insights into what influenced you to pursue a graduate degree in public health. I think this next question actually kind of segues right out of that one. The second question I would like to ask the panel is, what advice do you have for undergraduates regarding choosing the right program?
I don't mind taking it, a first stab at it, because it was also one of the things that kind of helped influence me. And just to be candid, like the financial aspect, like that also was a huge thing. Like, was I going to be able to afford this school that I was looking to go to, right? So that was one of the considerations, but also kind of thinking about the work that that school was doing. So kind of looking at each program to say, excuse me, looking at the professors, looking at their portfolios, whether, you know, their CVs, to test to see what type of activities they were engaged in. And it was something that I can see myself working with. So like, if there was someone at Georgia State, for example, that was working in HIV prevention among, you know, among Black people in Atlanta, right? So that's something that was very specific to me at that time that I really was interested in learning more about. So if that was someone who was working on that, which of course there was at Georgia State at that time, then that also helped me narrow down where I wanted to go. I think also what was important was if they offered like opportunities to serve as graduate research assistants. Like I think I had like a long checklist of like, okay, these are the schools that I'm interested in and these are the reasons why. And then I went to those schools' websites and really just kind of did my due diligence to kind of see, okay, let me take a look at the professors in the program. Let me take a look at some of the courses that they are requiring, you know, for their students to take in the program. So those were definitely some of the considerations that went into me selecting programs to apply for. And I think the process relatively, well, I don't know if that's the next question, but I'll just stop there.
I agree with Brittany. Like, I think it really was the financial aspect was one of like a major thing, because school's expensive, and like GRA opportunities. And it really was about finding people or professors that were doing work that you were interested in. And the geographic location of Atlanta is awesome, because there's just so many like cool like opportunities and like organizations that are based here. So I knew that like being at Georgia State's a good location, because you're able to like professors have connections with these different organizations. You're able to like intern, you're able to like have these connections that maybe you wouldn't have if you were at a different location.
Yeah, you guys really hit the points that I was going to say too. But yeah, see, so many schools offer different programs, obviously, and I think generally it really just depends on your interest if we're going from a basic standpoint. But I think for me also, it's like you don't necessarily have to go into the MPH program with a very specific goal right off the beginning. From my experience, I at least for my thoughts, I believe public health is one of the most like interdisciplinary areas of study. So you can come from any background and provide important perspectives in areas that are constantly evolving. And so I found that each core competency, or at least the ones that I found through Georgia State, whether it's policy, biostat, epi, etc., they're really important and can be found and used in the workplace usually.
Oh, thank you all so much. So definitely area of interest, location is important. Trying to find that right fit. Those are some of the questions that we also get here in my office. They will ask us a lot of different types of questions just to see what the, if the fit is right for them. So thank you all so much for that. And we're going to move on to the next question. And this one comes up quite a bit, and I know, so I'm just going to ask you guys, because you've had these experiences. How can students find networking events to engage with alumni and current students of their target programs?
I would say that they send out so many emails through the School of Public Health, and just making sure that you're reading them and that you're like seeing different, like seeing all the opportunities that are out there. I think when I was an undergrad, I wasn't so great about like reading emails or like seeing different opportunities that are going on, but there is so many opportunities that are going on. And like I said earlier, like the location of Georgia State makes it so great that there's so many like people that are nearby. So, looking at when I'm on campus, looking at the different boards that have different opportunities and just like attending these things, because like the connections you make when you're in school do definitely impact your future career. So I think it's really important to take advantage of like all of the having all of that at your fingertips.
Yeah, I totally agree. Unfortunately, during my time with the master's program, I wasn't able to really kind of venture out and network as much given the pandemic and all. But now that things are, want to say moving forward in a way where, networking is becoming more prevalent, um, I definitely recommend not being, scared or worried about, um, I guess, the size or what's going on with the networking event. I mean, if I had the ability to go back and attend all of them, I 100% would. I think they're fantastic areas to meet new individuals, whether to the school. And there are also other organizations outside of just the graduate program or the school of public health, like APHA, CSCE, that have these boards where you can actually find a lot of alumni attend and generally go to those webinars as well. So that's kind of actually how I met some additional alumni.
Yeah, I would piggyback and agree, especially with like the emails, because sometimes, you don't, you don't read the email and, you could possibly miss out on opportunity. But I think also for me, LinkedIn is like that girl, like she was around, there was this time where like people would post their flyers on LinkedIn, and that's also a really great way to connect with CDC alum, excuse me, GSU alum. And also, for me, because I work at CDC, like I'm able to meet, um, Georgia State graduates who are interested in coming to CDC. So that's a really great way for us to network, and also like once they've connected with me and I can share my network with them, you know what I mean? I think those are also really great opportunities because, um, if you're like you mentioned, like if you're maybe a little shy with like having to like come up to someone in person to out, to ask about network opportunities, I think sending like a message on social media, whether it's LinkedIn or something like that, it kind of takes away the anxiety about like the in-person contact. I think also, I don't know if like flyering is a thing. I feel like sometimes at Georgia State, there are rules against where or what you can place flyers up, but I think flyering is also a good way to be aware of what networking events may happen. And again, also like you mentioned, kind of like also being active in other organizations allows you to kind of mix and mingle with different people and be like, oh, hey, we have this networking event at XYZ. And you also never know who is going to be at those events. So it's just really all about, trying, I guess, as much as to be involved as possible, in the sense where I don't want to say that. I guess I kind of will take that back because I know Georgia State is also known for being like a commuter school. So like, not everyone has the luxury of being able to stay on campus and be actively, engaged in organizations on campus. But I think if possible to maybe at least be on a listserv of an organization that you may be interested in, that always allow you to kind of stay in the know somehow without having to physically stay on campus if you're not able to do so.
Thank you all. The next couple of questions are going to be about the actual application process. So you've all gone through that. And so I think we want to address that. That's a question that a lot of applicants they're curious about how this works. And so we So the next question will be, looking back, what aspects of the graduate school application process do you wish you had known more about or paid more attention to?
I think, Brittany, you mentioned this earlier in terms of having that checklist of things that you were looking for with the schools and for me, I really wasn't I went through the graduate certification program initially because I wasn't entirely too sure that I wanted to go to the program. So uh, I was just kind of thrown into the mix of that. So I guess for me, I wish I would have taken more time to simply just reach out to the School of Public Health or other institutions rather than just browse online. I know, obviously looking at websites and troubleshooting or looking at FAQs or um, the ease of access is great, but I think some answers are provided quicker or in more detail through conversations, and you can have the ability to learn more about the services and processes in general. I think some institutions, as well as Georgia State specifically, like you can just kind of talk about really anything and kind of get the full grasp of what you're looking for rather than um, struggle or just go through online or just not have your answer, your question answered. So.
So, and again, staying in line with the actual application process itself, since our audience most likely are trying to figure out how to apply. Can you offer tips for crafting strong applications for graduate school?
I think that it's really important to have your references and that like I said, was working professionally for a while, and I didn't feel like I had those connections with previous like professors when I from undergrad. So I kind of spoke to the people who were doing my references and kind of explaining to them what my passions were and like what my interests were in the program, so they could also communicate that when they were writing my recommendations. I think it was like helpful, so they can kind of be like, okay, like I know that Brittany really is passionate about these things, so when I'm writing it, I will say that there's like I I identify why she also wants to be in the program. Because sometimes it's not exactly, you don't have the same background. Like I said, I didn't have a background in public health. So I did kind of talk to the people and like, hey, I want to do this. This is why I'm interested in the program. This is like what my goals are with the program. This is like what I like about the school, and kind of talking to them about that. So it helped make my application stronger.
I would also recommend to, when you're writing whether it's when you're submitting your, statement of purpose, to like have as many people review as possible. Well, I guess not too many people, like if you have a mentor, I would for sure recommend having a mentor review it, and also a family or friend to review it, just for someone who is not who doesn't maybe have the background in public health, to be able to resonate with your statement of purpose, to kind of give it that, okay, this actually, flows well, you know what I mean, is able to capture the audience that you're looking to capture. I think that's also something that really was helpful, is because I think sometimes when you read it yourself, multiple times, you're probably gonna miss something. You may miss a mistake because your eyes are on it all the time. So I definitely would recommend at least maybe two other people to review, someone, family or friend, and then also someone maybe in a professional sphere, like your professor, a professor that you were close with in undergrad possibly, or a mentor that you have, or a supervisor as well. I think that definitely does help.
Thank you all. Um, this next question also ties in with the application process. In hindsight, what skills or experiences from your undergraduate education were most valuable in preparing you for success in your public health graduate program?
So as I mentioned earlier, in my undergraduate, there really wasn't a specific public health degree. So a lot of the um, courses that I did take, I think there were maybe, I want to say two or three electives that actually were epi specific. But uh, the writing courses that I had taken in my undergraduate program were extremely imperative in the master's for me, just because I have the ability of, just having strong writing skills, especially when it comes to research in general. I think there are some, or I think there was some research courses that I had taken that kind of helped me understand how, like, sources and sites and the proper way of citing these areas when I'm working on other projects. Outside of that, I can't really think of other courses, but I might circle back.
Thank you. But if no one else is gonna go, we'll move on to the next question. And this comes up all the time. What strategies can students use to finance their graduate education in public health?
I would say try and get a GRA. They send so many emails out about GRA positions. And also, like, what I did is I looked at the School of Public Health website and I kind of saw like what were the different like places that I could possibly apply for GRAs at, and I reached out to a lot of them that I was interested in, and I ended up getting my GRA that way. So I think it was like really awesome to kind of just, it's so many people I know are GRAs, and it's just like a great way to help with, making a little bit of extra money while you're in school, getting your tuition covered. And also it helps you make a lot of good connections, and it helps you like, gain some professional experience in the field, and kind of like while you're in school and just gain mentors. So I definitely say GRA all the way.
Yeah, I 100% agree with that. uh, I honestly wish that I had pursued that, or at least had been more aware myself. And that's, I'm the only one to blame in terms of going through that checklist when I was going through the application process. I didn't keep that in mind. And I will say that there are a lot of scholarship opportunities available. And they are, I want to say that I saw some listed through GSU's website, but just in general, I think those are great ways to finance the graduate program.
Yeah, I definitely was going to echo what Gabe was saying, because for me, that is one thing in hindsight I wish I would have done more, is like seeking scholarships, for sure. Because I know not everyone has the opportunity to have a GRA and be on campus and work, where you go to school. Thankfully I did have a GRA, so that's why I'm like, if you can get a GRA, that's amazing. But also take advantage of looking through scholarships that are available, because again, that's something that if I if I could do again, I definitely would look for additional scholarships as well.
Thank you all very much. That's a super important question. That's one we get all the time. That we have students who are very interested in public health, but are just trying to figure out, well, how am I going to pay the cost of the program, and what can I do, and how early do I need to start doing that? And it's never too early to look for opportunities or to kind of apply for scholarships. There's so many of them that are external as well. We have them at GSU, but there are also external ones that some of our incoming students, like for instance, we've got now more recently APHA Kaiser Permanente scholarships, that we have some of our students come in with those. So some students are coming in fully funded with different types of scholarships, organizations backing them. So, I say never give up, and GRAs are always great. I wish everyone could could have a GRA.
I totally agree, and I just wanted to add one last aspect to that. Not only are GRA opportunities great on the resume, but outside of that, what I had done was I actually enrolled in a paid internship with DPH during my master's program as well. Given that I didn't have as many hours doing the certification at first. So, I'd recommend, reaching out to other areas of public health if you have the time and availability, because they're always looking for extra assistance, and they're almost always willing to work with students in any capacity.
That's actually one of the questions we had here, was about how important the internships and extracurricular activities are when you're in undergrad, before you actually apply. How important are those, the research experiences? Can any of you speak to that, about how important that would be when applying to a graduate program in public health?
I would say it's like important to definitely like get involved in like anything that you can while you're an undergrad. Like Brittany said, Georgia State is a commuter school. So I think when I was in undergrad, I kind of felt like, oh, like I'm driving back and forth to campus. Like I didn't get involved as I wanted to. And so when I graduated, I did like work professionally for a little bit to gain some more like professional experiences. But now that I'm in the graduate program, I've really like tried to course correct that and get involved in as much things as possible, just because there is so many opportunities. So I would say like when you are an undergrad, just to take advantage of like the things that you can, and like there's so many opportunities. Georgia State is great at like having different events and different like connections for internships. So use the resources that you can while you're in the program.
Also, if you don't have the opportunity to like actually do things on campus, Atlanta has so many community-based organizations that you can volunteer with that it's amazing. It's like an influx of like where you can go to intern, even if it's for the summer. Having that unpaid internship experience definitely shows a lot. It allows you, it gives whoever is reviewing your application packet to see like, oh wow, they know how to work with XYZ population. They know how to work in a fast-paced environment. They know how to work with collecting sensitive information. Like those type of things are really, really great. And again, Atlanta has so many organizations that you can volunteer with, and they're always looking for people. Like for the most part, most organizations have a link on their website that says outreach or like volunteer opportunities. That I definitely would recommend that as well if you don't have the option to like actually do something on campus. Like if you may not be able to join an organization on Georgia State campus, there's so much community work that is needed and can be done in Atlanta, or even in surrounding areas. If you live in Lawrenceville, like if you live somewhere else, there's so many opportunities to engage in volunteer activities. And I think that definitely does really look great on a resume as well.
Yeah, those are some fantastic points, and that's exactly what I was going to echo as well. I think for me, the undergraduate internships that I had, once I was within the, because I did mine with CDC, I found out that they're always looking for additional help, and I think they have some fantastic opportunities, and not just CDC, whether it's DPH, a larger or smaller or community-based organization. I think and I did my internship towards the end of my undergraduate career, but I wish that I personally had just reached out and asked. A lot of these organizations and companies would more than happily take any assistance. And now, given that there are some opportunities that might be more online or web-based, I think there's an even greater need. So definitely recommend that.
And also, sorry, Denise, I also want to tie it back into like that networking aspect. So for example, you may not find anything online, right? Like yourself as you're searching, but if you're connected to someone who knows someone who knows someone, like you mentioned, like there's so many opportunities that people like, there's always someone that's looking for a recent graduate, like, or there's someone looking for a current student. Like there's so many opportunities that are out there. And I think it's definitely really impaired. If you haven't already, I would encourage you all to make those connections while you're physically on campus, or even you're taking virtual, like connect with those professors to say like, hey, do you know anyone who's looking for someone who has experience in XYZ? They'll be like, oh, I don't know anyone, but let me see if my colleague knows someone. And then that colleague will, I think that's really big. Like I really try to encourage the networking aspect, because I think that definitely got me very far where I am in my career today. So I definitely want to plant that seed and put that out there as well.
Thank you all so much for your insight. And I think I know we've come to the end of the the audience questions that we received, and certainly I know we have some guests on. If they have questions that they would like to ask, they can do that as well. So that we make sure that we cover everything that everyone would like to know. But you know, seeing folks like you who have graduated out of our program and where you've gone, how your careers have developed. I think that is also a huge driver for students applying to our programs, because they can see where they can go after they leave the program. So a lot of applicants ask that question coming in the door. So what can I do with this degree? You know, who can I talk to? And you know, we're always happy to point them to our alum. Oh, they're doing this, they're doing that. And that's actually a main driver. I just wanted to throw that in there, that we get that question here at the administrative level of admissions, where students they're wanting to make sure that they're applying to something that is meaningful, that and they want to see proof of our alum. What have you become, you know, after leaving the program? I think that helps a lot too in driving the decision to apply to a particular school or not. Well, like I said, we've come to the end of the question and answer portion, and I am going to let each of you have some closing comments. Again, I can't thank you all enough for taking the time to, you know, be here today to talk about applying to graduate school. Is very important. There are a lot of undergrad students who are just trying to find a way, and so I think that you know, you being here today was very helpful for those students. So I'll have you all each go around and give your closing remarks, and then we can wrap up. And I'll also check the chat to see if we have any other questions while we're doing that. So take it away, whoever wants to go first.
I don't mind going first. I think I just wanted to express again, thank you, Denise, for having us here. I always enjoy speaking to fellow Panthers. Like, I love it. Like, I think because again, so much was poured into me and helped me grow as a public health professional. Both my undergraduate, you know, degree from Georgia State and my master's from Georgia State, like clearly, you know, hashtag bleed blue. So I definitely loved my experience at Georgia State, and I think it has so much to offer. If I could have like one last takeaway, it would be for sure to find ways to navigate this space by talking to people. And I know there's a variety of personalities, whether you're extrovert, introvert, ambivert, like those type of things. But again, I think a nice email will help go a long way, because you never know who can connect you to the person that'll help guide you, just help guide you in general. And I'm always available if you guys want to, you know, follow me on LinkedIn. I'm always willing to connect you with people, always willing to mentor. So, yeah, that's my, I guess, closing remarks for me.
Yes, I greatly appreciate the ability to attend this and to speak to you all. I guess for me, in terms of closing remarks, as an undergraduate student, I was very uncertain and unsure, and as the first in my family to even attend college in general, the graduate program was definitely I felt like a larger task at first, but Georgia State honestly had like one of the best onboarding processes and application processes for me. So it was honestly a relief when I was able to get all the information I wanted. And I think that all in all, with public health, I think, again, for me, I didn't have a very specific goal or idea in mind when I had initially started. But if I can say anything, it's that I think that public health is so interdisciplinary, and that now more than ever, I think we need to have additional focuses and insights and ideas, and to never hesitate to reach out or contact or connect, especially now post-pandemic. I know that there's a huge rift with what had happened. So please feel free to reach out, whether through LinkedIn, etc. Always happy to connect and yeah, thanks.
So I have two closing remarks. One is one of the things that I love so much about going to the School of Public Health at Georgia State is the diversity. There's so many people from a variety of different backgrounds from like different countries who people who are doctors in other countries, and like they're able to like pour their experience into you, and you're able to like learn so much from like people that you maybe wouldn't have met in a different context. And that's like one of the things that makes it like such a good experience all around. The other thing is like take advantage of all the opportunities while you're there, and like just don't be afraid to talk to people, and don't be afraid to like you know whenever you see an email, don't be like a shy person. I studied abroad in Brazil over the summer, and it was something that like I saw people always talk about it in undergrad, and I was like, oh, I can't afford it, it's too much money, like I won't have the ability to do that. But I like spoke to the program coordinator, and I was able to get my trip almost fully funded through scholarships and different like opportunities through the School of Public Health. And it was honestly the most life-changing experience. And it was like such a good thing that I was able to take advantage of. Also, like I work in a lab now, and I just like was able to get that opportunity because I had my APE. And then after that, I was like, hey, I'm really enjoying this. Like I found something I'm really passionate about. Like, is it possible to stay? And I was able to stay working in that lab. So like there's so many opportunities and so many cool things. And like my mentor in the lab is like an incredible person, and always like sending me opportunities for things. And like I can just say like, hey, I'm interested in this, I want to learn more about this. And she's like, cool, like let me see who I can reach out to who can help you like get that like experience or have that opportunity. Or like, I saw this conference I want to go to, like can you help me figure out how I can fund going to this conference? And like she's like, okay, well, we'll talk to this person and see what we can do. So I think it's just great to like the professors at Georgia State really do love their job. They really do love their students. They care so much. Dr. Faval actually is our faculty advisor for this LGBT mentorship club that we have on campus for public health students, and trying to like foster mentorship and community within that. So like it's something that he believed in, and God helped us get off the ground. So like there's so many opportunities, and if you have an idea, you can like talk to somebody about it, and they can help you make that dream a reality. So I think that's like one of the cool things about being a Panther.
Well, awesome. Thank you so much. I mean, this just means a lot to us. Again, I can't thank each of you enough for taking the time to have this conversation about applying to graduate school and sharing your experiences. It means so much to us, and so much to students who are looking to apply to our program. So we've come to the end. Want to wish you all a wonderful day and rest of the day and a fabulous weekend. And just thank you so much for coming out. It is greatly appreciated.